Can niacinamide and metformin reverse aging? Update February 2019. This is an update of my personal experiences with metformin, niacinamide, also known as nicotinamide, and statins as a physician. No endorsement of treatment is made. No medical recommendations are implied. This work was completed without any funding. Exact dosing schedules will not be discussed. Secondary to potential harm. Regimen of treatment must always be under the direct care of a board-certified internist. Researchers have discovered how to slow aging. Natural product fusidic acid found to reduce the level of damaged cells in the body caused by aging. The immune system's fountain of youth, helping the immune system clear away old cells in aging mice, help restore youthful characteristics. Molecule with anti-aging effects on vascular system identified. Beta-hydroxybutyrate produced during fasting or calorie restriction has anti-aging effects on the vascular system. This is what was published in both the lay press and medical literature in just 1 week. Quite amazing, but is it useful? Aging is a generalized problem and not specific to any one pathway. It is a global decline in cellular processes across all the tissues. No one specific intervention is likely to alter human health span or lifespan. I am skeptical of fantastic claims of aging reversal from a single pharmaceutical. Interesting but not useful. Any global treatment of the aging process will require multiple pharmaceuticals and environmental with lifestyle modifications. When the risk of death from a disease decreases, the risk of death from other diseases increases. This is an epidemiologic principle of medicine. Finding a cure for cancer would increase the prevalence of Alzheimer's dementia. For example, in long-lived populations, most deaths occur when multiple age-related diseases result in frailty and disability. This point in the life cycle is irreversible and beyond the scope of modern medicine to correct. Making people healthier, earlier, and longer health span is preferable to extending maximum lifespan. In this figure, we see the incidence of death 1900 compared to 2016. In 1900, before the age of 11, death was astronomical compared to current standards. We also see life expectancy has increased from around 71 to 87 years of age. The red zone represents the period of time when frailty and disability predominate. The initial gains in life expectancy since 1900 were achieved by reducing mortality in young people. Vaccines, antibiotics, sanitation, and public health innovations. Current environmental factors negate some of these benefits in 2019. Obesity, metabolic syndrome, hypertension, coronary artery disease, and diabetes, many of which are related to the abundance of food. Despite the environmental factors, there is still an explosive growth of humans greater than 70 years of age, resulting in a higher incidence of Alzheimer and vascular dementias, frailty, and cancer. The goal of anti-aging science is to compress the red zone to as close as possible to maximum lifespan, and thus improving health span. The anti-aging industry is selling the fountain of youth for big dollars without evidence of benefit. Despite large numbers of reports that a drug, nutrient, or compound prolongs healthy lifespan in laboratory animals, human beneficial effects have yet to be realized. Deceleration of the aging process preserves the status quo and is desirable. Rejuvenation essentially means reversal of the biological processes of aging and would be nice. I'll provide commentary if any deceleration or rejuvenation of the aging process can be demonstrated in my specific case. Richard Overton, America's oldest World War II veteran and the third oldest man in the world died December 27, 2018 from pneumonia. He was 112 years old and a centenarian. Centenarians show a delay in the onset of age-related diseases. Cardiovascular disease, type 2 diabetes, cancer, and Alzheimer's disease. Aging humans suffer from many diseases simultaneously: hypertension, atherosclerosis, osteoarthritis. The list is endless. Human longevity is limited by age-related diseases. Aging can be defined as the accumulation of age-related diseases over time, and healthy aging is delaying the onset of age-related diseases. This definition is pragmatic, reasonable, and measurable in 2019. If a pharmaceutical or nutraceutical can delay the onset of age-related diseases in humans, then it meets my criteria as an anti-aging drug. If a drug or cocktail of drugs delays the onset of age-related diseases, a person must live healthier and longer. I don't have the time for lifelong drug studies of human aging. Fantastic anti-aging studies in worms, flies, or mice are interesting but cannot be trusted. Healthy aging should be the goal of anti-aging therapies, and healthy aging is the primary goal of this discussion, not aesthetic or cosmetic improvement in appearance. If you desire this outcome, please go see a plastic surgeon. And only well-conducted human studies and FDA-approved drugs can be trusted and show promise. This discussion essentially involves repurposing drugs that have already been used in humans for decades. Niacinamide, also known as nicotinamide, and metformin are the initial two treatments. A statin, rosuvastatin, was initiated in early 2018. Treatments began in January 2016 and continue through February 2019. Toxicological scrutiny and frequent laboratory testing are mandatory, and my extensive laboratory profile from January 2019 will be reviewed in this presentation. My therapies are not FDA approved for aging and are thus off-label. The medications are readily available, inexpensive, and validated in animal and human model systems. The medications and nutraceuticals are FDA approved for human use. Physiology, pharmacokinetics, pharmacodynamics, and safety profiles of these drugs were reviewed in the previous lecture on my YouTube site in 2018. This intervention was only pharmacological. Nicotinamide adenine dinucleotide is a cofactor and substrate for ATP synthesis, DNA repair, and is very important in reducing oxidative cell damage from mitochondrial physiology. NAD concentrations increase during fasting, exercise, and caloric restriction. NAD levels decline during aging and may be a major contributor to the aging process. NAD precursors like nicotinamide or niacinamide represent a therapeutic strategy to mediate some aspects of the aging process. Nicotinamide, also known as niacinamide, is not niacin, which is a completely different drug. I would like to talk about a well-conducted study of nicotinamide riboside in healthy adults published in 2018. In this study, it was randomized, double-blind, placebo-controlled with nicotinamide riboside. The dosing was 1,000 milligrams daily for 6 weeks, and no significant treatment adverse effects were noted. The study did demonstrate elevated levels of NAD and AAD, nicotinamide, AMP, ADP, and ATP, which is quite convincing for therapeutic efficacy. Nicotinamide riboside is perfectly fine as an NAD precursor, but very expensive. I prefer simple nicotinamide or niacinamide alone. In a study in cell metabolism in 2018, in a mice model, nicotinamide riboside is converted in the liver to niacinamide, so there is essentially no difference between the two. Niacinamide can cause serious complications. This is a case report published in 1973 of hepatic toxicity from large-dose nicotinamide niacinamide ingestion. A 35-year-old male had been taken nicotinamide for 3 grams a day for 18 months for schizophrenia. This was done back in 1973, but in 2019 it has no therapeutic effect. He presented to the emergency room with nausea, vomiting, jaundice, and acute hepatitis. And he later revealed that he had increased his dose to 9 grams daily several days prior to admission. AST, ALT, total bilirubin were markedly elevated. These are liver-associated enzymes indicative of hepatitis. Liver biopsy revealed portal fibrosis. The positive aspect of this is that liver studies completely normalized after 3 weeks once the medication was stopped. So the lesson from this is that the maximum dosage is 3 grams per day, and in most individuals, much, much less. Metformin was approved in the United States in 1995 for the treatment of diabetes mellitus type 2 and in 1958 in Europe. Metformin is inexpensive and safe in ameliorating hyperglycemia and hyperinsulinemia by reducing insulin levels and improving insulin site of action. It specifically inhibits lipogenesis, it mitigates hyperlipidemia, it reduces cellular levels of reactive oxygen species, and downregulates pro-inflammatory cytokines. All very good and well. Further, it reduces the risk of cancer in patients with type 2 diabetes, improves prognosis and survival in cancer patients, and may extend human health and lifespan. The mechanism of action is that it activates the AMPK enzyme, which results in a reduced mTOR activity. If you want to further understand what that means, please refer to the initial YouTube presentation in 2018. The recommended daily dosage is 1 to 2 grams daily. Most common side effect is gastrointestinal, which is transient and avoided by gradual escalation of dosage. Adverse effects: B12 deficiency with anemia in some patients, and a very rare but potentially fatal lactic acidosis. Further, metformin is contraindicated in severe renal or hepatic failure. We're now going to review my laboratory studies from February of 2019. Comprehensive metabolic panel, complete blood count, hemoglobin A1C, also known as glycosylated hemoglobin, and full lipid profile. This is the first half of my metabolic panel, demonstrating my glucose is 97 milligrams per deciliter, normal. My blood urea nitrogen 19, creatinine 1.01, also normal. Also at the bottom, sodium, a significant serum electrolyte, normal at 139. The second part of my metabolic panel, potassium 4.3, chloride 102, carbon dioxide 27, calcium 10, total protein 6.9, albumin 4.7, total bilirubin 0.8, alkaline phosphatase 48, AST and ALT completely normal. The AST and ALT are critical because of the potential complications from niacinamide. And in some cases with high doses, as stated, niacinamide can cause liver enzyme abnormalities and need to be monitored closely. Hemoglobin A1C also stands for glycosylated hemoglobin, which is a biomarker of the effectiveness of the current metformin dosing regimen. The lower, the better. My hemoglobin A1C came down to 5.3, and 5.3 is consistent with the absence of diabetes. The lower, the better, and I'm quite happy with this result. This is my complete blood count. White blood cell count 9.4, hemoglobin 15.6, hematocrit 43.9. I highlight mean corpuscular volume of 89.8, which is normal, normal differential, normal platelet count. Vitamin B12 is consumed by metformin and in some cases can result in a macrocytic anemia. Metformin and macrocytic anemia. The association of biochemical B12 deficiency with metformin therapy and B12 supplements has been recognized for several years now. Classical B12 deficiency is associated with macrocytic anemia, neuropathy, and cognitive impairment. And biochemical B12 deficiency is noted in metformin users and should be monitored. B12, 1,000 micrograms daily, was added to my regimen as a prophylaxis. This is my lipid panel demonstrating a total cholesterol of 88, an HDL cholesterol of 39, triglycerides of 97, LDL cholesterol of 31, with a non-HDL cholesterol of 49. I would argue this is a remarkably healthy cholesterol panel. Even though the HDL is low, I suspect it's low because my LDL is super low. Statins as an anti-aging therapy. Statins, or HMG-CoA reductase inhibitors, prevent atherosclerosis and coronary vascular disease. Atherosclerosis is a diffuse, age-related disease that affects the entire vasculature of the body. Statin therapy is the cornerstone of treatment for individuals with coronary artery disease and cardiac risk factors. Statin use in healthy individuals, however, remains controversial. The drug's ability to mitigate the development of atherosclerosis is well established. As well, it has an excellent safety profile and well-defined toxicity in certain groups. The chart demonstrates that atherosclerosis is a typical age-related disease with increased incidence as we age and increased fatal events being more frequent the older we are. Statins may not exactly be novel or exciting. It remains an excellent intervention point in mediating the development of the atheromatous plaque throughout the entire body in healthy individuals. Statin use and the reduction in cardiovascular mortality in adults without cardiovascular disease. In a meta-analysis for statins and the prevention of cardiovascular disease published in 2016, 71,344 patients without cardiovascular events were analyzed. Overall, there was a decreased all-cause mortality, decreased cardiovascular mortality, decreased incidence of stroke, decreased incidence of heart attack, with no significant increased incidence of adverse events. A very positive study. Statin use and reduction in cancer mortality. In this study, a meta-analysis of 1 million individuals, the effects of statins on cancer mortality and progression was reviewed in the International Journal of Cancer 2017. Statins have anti-cancer properties beyond cardiovascular benefits, decreased all-cause mortality, decreased cancer-specific mortality, increased progression-free survival after the diagnosis of cancer, and increased recurrence-free survival after the diagnosis of cancer. Statins prevent and/or ameliorate cardiovascular and neoplastic morbidity and mortality. They represent an exciting anti-aging adjunct in healthy adults to prevent some age-related diseases. I started rosuvastatin for a target LDL less than 100 milligrams per deciliter based upon these studies. Metformin and niacinamide have no effect on the lipid profile, and consequently, this risk profile is completely untreated by the combination therapy of metformin and niacinamide. Statins are contraindicated in liver disease, and some people develop myopathy or chronic muscle pain, and thus their initiation and usage must be followed by a board-certified internist. Commentary on benefits and harms. Lab studies are normal and had been normal for over 37 months. No significant adverse events or toxicity identified. No active health problems. Systolic blood pressure on treatment consistently less than 120 millimeters of mercury. Body mass index 25 and weight stable at 165. Initially, before I started therapy, the body mass index was 34 and the weight was 215. I would argue, based upon this data, deceleration of aging is the primary benefit. Rejuvenation and overall appearance, skin texture and quality is subjective, although I suspect there is a component of rejuvenation. An aversion to glucose-rich foods developed after 3 months and persists up until today. Significant recovery of short-term and long-term memory, markedly enhanced sleep quality and restorative sleep. No gain or loss in stamina or exercise capacity. No increase or decrease in infection or wound healing. Aging, however, persists with graying of the hair, male pattern baldness, presbyopia, and mild osteoarthritis. In precision medicine, therapies are customized on a patient's genetic profile, risk profile, and comorbidities. The creation of unique combinations of treatments that may benefit specific patients is the future of anti-aging therapies. For my particular circumstances, the profile risk, niacinamide, metformin, and rosuvastatin are the most reasonable. Hopefully in 2020, I can discuss new pharmaceuticals that have similar convincing anti-aging benefits. Thank you.